psychologist, and I do largely behavioral treatment. So elopement is a common issue that we face every day in our behavioral treatment programs and try to work with families to address. And then we've also had to address it as a hospital center when kids are trying to leave our medical center. So I'll present on both of those kind of aspects to see if we can reach a broad range of what you need. So today we're just going to focus on understanding what drives elopement in children, strategies to implement across different environments, and again, how to think about crisis management and recovery. Because if children, first we want to prevent them getting away, but if they do get away, we need to make sure we get them back safely. So we're going to start with talking about what elopement is and how it impacts, and then we'll go into the strategies a little bit more detailed. So behaviorally, we define elopement not as getting married, but actually as leaving a designated area without permission of a caregiver. And I joke about getting married, but when you talk about this in large context, some people are very confused on elopement because they do equate it with the more social norm of getting married. So it's really important to make sure that you understand what everybody is discussing. Parents typically describe this behavior as my child wanders off, they bolt away, they define them as a runner, they escape places. All of those things typically equate to leaving that place without permission and sometimes without a caregiver knowing, which is clearly very unsafe. So a national survey was conducted in the last couple of years, and I think the rates of elopement came back higher than any of us had expected to see it. So nearly half of the children with autism between the ages of 4 and 10 elope. And this is really alarming because it's about 4 times higher than their unaffected siblings. And again, when you look at the higher end of that group, still 30% are still engaging in elopement. So, and this is a rate 8 times higher. So it is a very significant issue for parents of kids with autism. And when you look at this graph, this really shows how it does decrease over time, similar to typical development, but at a much slower rate. And at the very end of that, you'll see in the teen years, it tends to go up a little bit again, and that's another area that's going to need future study in terms of what the factors are and why elopement would increase again with the higher ages. As we look at the elopement, it becomes a very serious safety issue when we think about many of these children do not know how to communicate any safety information to people who may find them or come across them. So 35% of the families in the study were not able to do this at all. And then the other children, some of them can only present minimal information or in very specific ways that may actually limit their ability to give information to people who may be trying to help them. The more severe the autism is, what the research shows us is that you are more likely to have risk for elopement. And again, most of these cases come from home, which is probably where children spend their predominant time. It's commonly seen in stores and classrooms and schools as well. So it's everywhere that families can take them. And from the families we see clinically, I would say they worry about this all the time. Many of the families I've worked with have said specifically that it happens more at home because you're trying to do the laundry or take care of those basic needs. You think you have the house pretty secured, and boom, they're gone. Where you're more likely to be right on top of them in stores and other areas where it occurs less often. Children with autism are often unaware of the dangers in the environment, so they may be driven by a specific thing but are not aware of how to cross the street or what they need to look out for. So this makes it very serious when they're out there alone. Of that additional data, kids are at higher risk for injury in that many that try to elope do succeed, about half of those. Many of the parents ended up calling the police in those situations, and then there was pretty high rate of a close call with traffic or with drowning. And in another study done in California, they were finding that the accidental causes of death in children with autism were pretty high, and they were seeing an increase in this. And many of these came from situations that occurred after a child had eloped. So that was also very alarming in this situation. Equally concerning is the access for help. So many parents have not felt they've received any guidance, and when they do, it's often from a pediatric pediatrician or a physician who may not always know exactly how to kind of approach the issue, the behavioral issue of elopement. Some had received advice from a mental health professional, but many still quote that they're not getting actual treatment for the behavior. So it can be really hard. When we look at this behaviorally as psychologists, one of the initial studies that I ever saw on elopement was done at Kennedy Krieger in 1997. They published it, and what they found is that you can actually take the behavior of elopement and apply your regular functional analysis methodology and reinforcement assessment methodology to determine what is driving that behavior so that we can treat it more specifically and hopefully more effectively. So they were able to demonstrate that it was effectively able to be treated if you use this methodology. Since then, more studies have emerged, which basically have found the same results. So when you have participants, and this ranged from 3 to 47, so I thought that was very interesting. Not all of these folks had autism, so many just had other developmental disabilities. But again, we can determine the function that drives that problem behavior and then develop a function-based treatment for it. So this is really promising in light of how often this is occurring and how unsafe the behavior is, as long as we can get the needed resources to the family so that they can have their child treated. So when we're looking at the behavioral function of elopement, it's really important to understand that there is a motivator behind why the children run. First thing we need to think about is, what are they seeking? So often kids will actually seek a tangible item, intense interest that they already have focused on in autism. I've had kids who run down the school hallway because they know that there's a gerbil in the next classroom. It can be something very specific. We have many children who are very intense on getting to water because they like water features or water play. So we've had kids run towards fountains and get in pools and lakes and streams, which can be very dangerous. The other portion of positive reinforcement is when they actually seek attention in an inappropriate way. So many kids love to be chased, or they love to be caught in that chase, and that becomes a fun game. So you see this a lot with toddlers and little children, even typically developing, where as you go grab them and pick them up, they're laughing and they think that's great. This may maintain in children with autism as well, so it has to be handled very carefully. The other side of it is that children will do this to get away from things, which is negative reinforcement. So they want to escape non-preferred, scary, overwhelming. Often sensory is a trigger for this because they want to escape an overwhelming sensory environment or input that they don't like, loud environments, crowds. All of these things can definitely be a trigger for elopement behavior. We see this a lot as I work in a hospital. In the inpatient medical procedures, we have kids who will try to run when they're scared of a procedure. So we do a lot of work with kids to make sure that they don't feel that overwhelmed with what we're needing to do, so they have a lot of supports in place. And then there's the internal sensory reinforcement, and much of this is a child who just loves to run for the sake of running. They don't care if you run with them or not. They don't care where they're at, but when they see a wide open space, they love the breeze in their hair, and they go. And so that can be a factor that makes it really hard to notice triggers or when they're going to actually want to do this. So those are the functions-based that we find with research. The nice thing is that the parent reports of motivation for elopement really match this. So it looks like in this wide-range study, we have motivation that matches what we find in the research. So the child who simply loves running or exploring, that can either be an attention-based if they like to be caught, or it can be just that sensory motivation, internal motivation. So want to reach a place they enjoy, that's the tangible motivation or that positive reinforcement. Pursuing a special topic is the positive reinforcement. Trying to escape the anxious situation or uncomfortable sensory stimuli are the escape-motivated functions. So they all match up quite well. And you can see in this one, most parents endorse the child just likes to run. There's probably a mixture of attention component in that, because many of the children that I've worked with who like to run also love to be chased. It makes it even much more exciting when you have someone running after you. And we have to, in elopement, we have to go after them, so it's a hard thing to manage. As we look at this from a treatment standpoint, there are many challenges when we're assessing and treating elopement. For one, anytime you're in a different situation or setting, the child may actually be responding to different stimuli that actually motivate the running, or the care providers may be responding in a different way at a school versus a home that might actually lead to the running occur. occurring. Other situations, our environments are very different in terms of the obstacles or the barriers put up for encouraging or discouraging elopement behavior. So all of those things have to be taken into account when you're assessing for elopement. It's not as specific as looking at the child in one context. You really need to look across the gamut, if the child, especially if the child has elopement across many environments. What's really helpful typically is to identify environments where the child is at risk or attempts to elope the most, and those that they rarely ever do, and then start to identify within those contexts why they might be prone to run in certain places or not others, and you have to look at all the different aspects that we'll go through in a minute in terms of prevention, as well as the functional behavioral motivation for eloping. The one challenge to folks who are treating elopement is that while it's great to get a decreasing trend of elopement, any elopement can result in a significant injury or fatality. So even when we get rates of elopement reduced, that might not be good enough if we can't get it completely gone, because it only takes one accident for something really serious to occur. So it's really important that we keep on this until we get all of the elopement under control. As we go through how to treat elopement, we're going to break it up into prevention and then individual treatments, and then how to recover a child who's eloped, and different things to think about across the environments. With prevention, the first thing we have to look at is looking at the specific environments that the child is in and how to secure those or make elopement less handy for the child to do. So how can we prevent them from getting out or give ourselves more time to be able to thwart an attempt to elope them? So for homes, we might be looking at locks on the windows, key locks instead of just the bolt locks that a child can easily learn to turn. There might need to be alarms, fenced-in backyards, even where you locate the child's bedroom, so that they have to go, past the parents to get out the door, or there can be other things that alarm them so that they can't escape basically without notice. All of those things can be taken into account. Depending on the funding of the family in terms of respite services or other modifications to the home, many of those agencies do have limitations on what's allowed due to fire safety and kind of life safety regulations. So some do not allow certain types of hardware to be put on the windows if it might prevent escape during a fire or other situation. And all of those things have to be taken into account when you're doing those. Parents who are doing them on their own have a little bit more leeway than the regulatory agencies, but if they end up getting respite staff in, they may have to be modified to the funding agency's approval for policy. Other things that we need to look at is what is adequate supervision. And obviously it is really, really challenging for families to be have the child with them every second of every day. And some people do recommend that, and we do recommend higher levels of supervision, but to run a house is very challenging, especially if you don't have any respite service providers at this point. So trying to help families identify what are the most at-risk times and places. So it may be that the child actually does fine in the basement while the family is doing laundry, because there's a long way to get up to get out to a door, and the windows are too high, and that's a safer place for them to be a little bit freer. But maybe when they're in the family room area, the kitchen area, that is the most at-risk time. And so trying to help the family think about during what times of the day do I have to have special precautions in place for my child to prevent this behavior from occurring is really helpful when it's not feasible for them to be with them every second. And then the other thing is what are the things in these environments that trigger? So when you look at does boredom trigger elopement? Are they going to run because they're bored, so they're seeking something that they want because they have nothing else that they want to do? Or is it during certain sensory times where it gets overwhelming and they have trouble managing it? I had one child who had more trouble when his siblings came home from school because the parent put the attention on the siblings to hear about their day, and this child would run and basically be out the door and have everybody chasing him to get the attention back on him. So looking at all of those different triggers and stressors and how they may impact that behavior, once you figure them out, then it's much easier to figure out a plan for how to manage each of those types of things. When we look at the community, it's a little bit more challenging because anytime a parent takes a child who has a history of elopement into a new place, usually try to recommend as best they can to learn the area in advance if they can, so that they can make a plan. And if they can't go in advance, then just trying to think about the things they're going to want to think about as they park and go into buildings and manage different situations, so that they have kind of a plan of attack should the child be motivated to elope from a situation. So just knowing where and what the triggers are in any environment. And then how do you manage that environment? So many children just need to know what's going to be happening in places. There needs to be plans for boredom so that you can entertain the child if you should have downtime that was unexpected. Obviously, hunger exacerbates almost everything. And so how can you distract the child or keep them focused or manage any fears that they may have going into a community environment? I always try to have parents plan entrance and exit plans if they're going to any place, especially one that they know. So parking close to the building may be great, but sometimes that's actually next to a trigger. So thinking about that very creatively and what are the options for parking so that you can manage any access to those triggers that may increase the chance for elopement. And then looking to see if there are any resources to help in really difficult to manage situations. Sometimes for kids going to certain therapy appointments or different things, they maybe actually have staff be able to escort in and out with them, or they may be able to utilize handicap parking stickers if they work with a pediatrician to make sure they can park close to certain places. But knowing what is around and what those triggers are so that they can try to address those, or even plan ahead for family to go with them or a care provider to assist on places that are really difficult to navigate. For individualized treatment, when we're targeting that specific behavior, the first thing we typically do is assess for behavioral function and really asking what that child is seeking. And that can be done through analog functional analysis or functional assessment, just by interviewing and talking to the parent and then testing out some hypotheses. Often I'll have parents take data on what's specifically happening, and we'll try to figure out what those motivating variables are. But really thinking, what is that child? Are they running to something? Are they running from something? Again, or do they just love to run? If they just love to run, do they like to be chased? What is their reaction when you catch them? Do they think it's a big game? Those types of things really help us identify those functions of behavior so that we can figure out how we might need to manage them or retrieve them in a way that doesn't reinforce the problem behavior. Within that, we're also looking for the things that trigger. So is this the sight of something? Is it just the impulse? Is it a big, long hallway? Trying to really help identify what things might set them off. With that, once we develop what that function is and the triggers, then we need to think about teaching the skills they need to develop to replace. So functional communication training is a common thing in behavior analysis that we use. So if I have a child who loves to be chased, and I think that attention seeking is the function of their behavior, I love to run, but I love it best when you chase me and tickle me and grab me, then I might teach that child to request chase and have them do it in safe locations several times a day, which can be a basement, it can be a fenced-in backyard, where we're going to teach them to communicate for that really fun play so that we start to put it on a play basis instead of requesting it out of the blue. For kids who like to go places or go look at things, or they see something and they just want to go check it out, often teaching them to request to look. And that can be through a picture exchange, it can be through a sign, it can be through words, whatever modalities that the child has, but requesting, I'm going to look, and then they take you with them to kind of show, and you go look together. So there's more examples finished. I need to be finished and take a break. I want help. I don't want to. Many of these kids can't express when they don't want to do something, or they're anxious or scared. When can I have what I want? Those types of things. So all of these things will help replace over time, but they take a long time to teach. So you still have to have all of your prevention in place, and then a plan for how do you teach this. We usually contrive the situation to try to elicit the motivation, prompt the communication, and then reinforce with the appropriate activity because they communicated. It can also be built back in that if the child elopes, that we make sure they don't get the reinforcer and bringing them back to prompt the communication, which I'll talk about more in a minute. Many kids need to learn to wait. That isn't a temperament, it's actually a skill, and it can be directly taught for helping kids wait for something they want or when they're anxious. And And this can be done via scheduling or a variety of other kind of methodologies where we desensitize the wait time over time under controlled situations, and then gradually kind of generalize it into the community. And then again, for kids with intense fear and anxiety or huge sensory sensitivities, we need to look at desensitization to those or other strategies to address. So if we're taking children into a very loud environment, often we'll take the sound-deafening headphones to help them cope while they're getting through. But there's many strategies for those once we identify exactly what it is that they're trying to escape or avoid or that's setting them off. And then we have to address each of those with a specific plan. A big portion, not only in teaching these replacement skills, is to make sure that we respond in a way that does not reinforce the problem behavior. So if a child that loves to be chased elopes and gets chased and grabbed and thinks it's hilarious and laughs every time, each time we get them in that way reinforces the problem behavior. So it's just going to keep that behavior occurring. Even with all the prevention, they're going to actually seek out to get chased and grabbed. So teaching them a replacement behavior, another way to get that appropriately, is very helpful. But if that child does elope, we need to think about how we go after them. We do have to go after them. So being calm, being matter of fact, try not to make it a game. If you're in a situation where you have more than one person, sending one person each way to kind of sandwich them between and then just not making a lot of eye contact, staying calm, grabbing a hand and saying, let's go back and take them back to where they're supposed to go is helpful. It's a little harder for a parent who's alone, but even then trying to be calm, going after them, soliciting help from others, but giving them the cues, do not laugh, do not reprimand, do not make this a big deal. When you're seeking them is very, very helpful to making it boring, basically making the retrieval. You need to be as efficient and careful as possible, but also from the child's perspective, trying to be very boring is very helpful. And then if we also need to make sure the child doesn't really get what they wanted. So if they jump into the fountain of water, they kind of got what they want, but when we pull them back out, we need to kind of get them out pretty efficiently rather than allowing them to continue to play in it if they didn't ask appropriately, because again, we don't want to reinforce the elopement. So if you're going to allow it, you need to take them back to where they elope from and prompt the communication and then allow them to go, so they have to kind of stop what they're doing to get the communication. It's usually more effective not to allow them get what they want at all, so that they learn that that didn't work at all. But there are variations depending on the situation for how you'd want to look at that. And again, if they're trying to escape something or run away from something, sometimes we can't. If we allow them to just go away, that again is going to reinforce the situation. If we are going to allow them to escape, it's better to at least take them back or part way back and then have them request finished and then allow them to leave, so that it's based on an appropriate communication. But many times it's better to just bring them back and require what they're doing, but give them a lot of support to get through it. So it depends on the situation again. But if we just allow them to escape, that's going to continue to happen. A young lady I worked with who would elope from her brother's baseball games because she didn't love to be there. And then the family would go get her in the car and she would get in and then they would take her home. And so we had to break that habit and bring her back. And so then they kept her in the car where they had safety locks, and she had to stay for a period of time, and then they allowed an appropriate communication for him finish, and then they would take her home. And it took about 2 weeks, but that behavior, she got very good at going to them and saying, I'm finished, and then they would take her home immediately to teach her that that's what's going to work the quickest. So just takes a lot of creativity and planning to make sure that you're teaching replacement behavior and not reinforcing the problem as it goes. So for recovery, this is another really tough area. I recommend that, highly recommend that every child with autism, no matter what their skill level, is either worked on from a pretty young age a way to communicate their name, address, and phone number, their basic safety information, their parents' names, from an early age, whether it's by handing over something, using a picture exchange, signing, verbal whatever means will work, and or making sure they have a medical bracement and shoe charm on. And typically I would say both until they're really reliable, just in the event that they get away from their care providers. We have had great success in the Cincinnati area with partnering with our local police and fire departments. And so I know there's many, many other areas doing this, but I still hear families who come to us who either aren't aware or don't have good systems set for this. But if you have a child who has a history of elopement, you can pair with the local police and fire department to talk to them about your child, what they look like, descriptions, sometimes pictures, what they like and don't like, how they respond, how they communicate, all of this information that can often be programmed into the 911 systems in local areas. And so there's a link here that contains a first responder information and sample forms, but many local fire departments have their own forms at this point that they use, and so I would recommend that any family start to develop a relationship with their local agencies and partner to help keep their child safe, so that if a call does go out, they have a little bit of information about this child, how to retrieve them, who they are, and what will need to happen. And there's many other portions in this toolkit to do that. But I think it's really, really important to help help your helpers help you. We have partnered with many agents, the local police stations in this area, and with really, really great success with many of the kids who have gotten out and have been retrieved much more quickly and much more safely and much more effectively. And over time, there's often folks who will work with you to not reinforce the problem behavior and make sure that they're trying to bring them back in a way that supports the behavior plan, which has been even better. So I highly encourage parents to do that as a safety mechanism right away as they start to work on this behavior. The other thing is making and practicing a recovery plan with families, neighbors, etc. So we do this with school systems for kids who have elopement issues. And we encourage our families, will help them make a plan, but they do it with their own neighbors and their family at home. And there are some different materials that actually help families think through all the facets of this. But it is, again, it takes a village, and trying to just have your village be aware that you're dealing with this issue and trying to help you from the get-go rather than just when you're in crisis. So trying to plan ahead as much as possible for this situation. Then seeking appropriate training. So some children, when stopped from eloping, do become combative. And so there have been times where we have tried to encourage people who outside of the police department who may be responding to stop an elopement, that they get trained in specific crisis management. And there are typically different types of crisis management available in different locations across the country. So anything that provides personal safety and safe physical management are typically very helpful to helping deal with those effectively. Technology is really advancing and is often very helpful. So there are new GPS systems out all the time, phones, watches, bracelets, things that are not supposed to be easy to take off to help you be able to track your child should they get away. There's a couple websites for those. They are constantly updating them, and I'm sure not an expert on all the ins and outs of that technology, but I do continually request that parents can look into that. I've had many of my teens or young teens who want to carry a phone, and it can be one of those very limited phones, but one that has GPS in it. And we have used those to track kids who have taken off from places, and people know they're gone, but they're pretty quick about darting through neighborhoods. So they've been very, very useful in finding the kids again pretty quickly and bringing them back. And then different door alarms are really helpful. We have a lot of families who use door alarm systems. If it's some of them, it's nothing more than you open the door and it goes beep, beep, but it just alerts somebody that a door or a window has been opened. So those can be very helpful for just alerting somebody that they got out. And then there's others that can actually be connected in with your local police department. And some of those are developed more for break-ins, but they're really helpful also for children getting out. And then we've had several families utilize service dogs in our area, and those dogs were trained specifically for that child and their behaviors and their needs. But for our kids who had histories of elopement, they were also trained in tracking and recovery, so that should the child get away, they could actually be sent to help find them. And I haven't don't think I've had a family actually need to use the dog for the tracking and recovery yet, but have had several train their dogs for that purpose. So I'm going to give you, that was kind of more of the community and family-based systems, and then I'm going to go through a really quick scenario that we used, a similar format for trying to prevent elopement from our organization, just for anybody who might be having trouble with a building level. And so our elopement work that we did at Cincinnati Children's Hospital was actually for kids with a variety of behavioral challenges, so not just children with autism, but all developmental disabilities, psychiatric issues, and then just general behavioral concerns. We had a team that was a very multidisciplinary team that was developed to address this, to look at both prevention and recovery for kids, to make sure that we didn't lose our patients here at the medical center, and we use quality improvement methodology to do that. So we had to look at prevention at a building level. Patients are now, when they're admitted to the hospital, have their photo taken, which is entered right into the medical record. That helps for a variety of things, but it's also helps us with a quick alert system should a child actually be successful in eloping out of their room. We also developed a security system for visitors coming in where they were photographed and badged. Increased all of our monitoring at our elevators because it's such a broad space. Required more badging, or more elevators have staff badge required to operate to prevent patients and families from inadvertently getting into the wrong elevators and being able to use them. And then all of our inpatient units were locked for entry and exit, which just was a nice barrier to prevent people from going where they shouldn't be going, really. And then patients are all stickered so that if you're walking around and you don't have a sticker, you'll be stopped and asked where you're going and what your purpose is. We assessed every single patient who comes into the emergency room or inpatient admissions for their risk for elopement. So are they actively saying that they're going to leave? Most of them are like, I'm getting out of here, I can't stay, I can't stand it here, I got to go. Is a parent concerned? Do they bring that up? Or does the clinical staff have some concern? And it can just be basically looking at the child's behavior or a gut feeling. We put a lot of trust in that in terms of clinical staff going, something's not right, and I'm afraid this patient might try to leave. And then if there is a concern, we look at, again, that very quick functional assessment, or what are the possible reasons. And so these are listed kind of specifically, but we're really looking at that functional analysis of when they come in the hospital, what are they avoiding? And these are common things that we've had kids want to avoid. And yes, it says jail because we do have some of our kids who get in trouble with the juvenile system and they come in because they've been injured in the interim or for psychiatric assessment. And then again, a lot of fear and anxiety with procedures at the hospital when they're sick and they don't want to be here, and it makes them sad. And then we have the abduction and social issue as well, which we wrapped in there because we have to have a lot of the same protocols. So for our interventions, when you're trying to have a lot of staff who interact with a child be aware, we had to increase our awareness. So any child or patient who is highlighted for a flight risk gets a specific color of gowns to wear to help staff identify that patient needs. We have to be extra precautious to make sure that they aren't going where they shouldn't be going or alone somewhere. They are flagged in our medical record, and we have a specific plan of care goal that's developed. We remove their personal items from the room, and there's some clinical judgment there, but part of that is you're much less likely to try to leave a facility if you don't have your clothes and your personal items because you don't want to leave without them. And then phone access is allowed, but it has to be supervised, and that's for our teenagers who call their friends to come get them out of the hospital, which has occurred. And then we just have plans for procedures outside of the room. So there's a elopement plan for that patient based on their risk of who needs to escort them where and how many staff we need. And they have to be with staff around the hospital. So typically our patients, are allowed to be with their parents around the hospital. But if you are on a flight risk, we actually require you to have staff with you as well, just to help support and make sure we don't have elopements that occur. And then we also we have more staff in the room at all times for patients with elopement risk. because we've had many be pretty crafty in how they're going to leave. And then we have individualized interventions, and that's those specific reasons the child may want to leave are specifically addressed with a plan. So our child life specialists and adaptive care team help adapt our care and help kids who are just scared of being in the hospital. We have a behavioral safety team that works on the more specific behavioral intervention plans for children who need that level. Psychiatry, behavioral psychology, and social work also support the overall issues and family issues as well to make sure we have a good comprehensive approach. We don't want you just locked in your room. We want to actually address the issues that might make you want to leave so that we get a well-rounded approach. I'm actually going to skip the slide for a minute because it should have been put behind this last one I just saw earlier. And then the final thing was our recovery plan. And again, that was just the code ATM responses, what it's used here at our hospital. But that's update, and then trainings have occurred with particular services for every inpatient unit. The focus here has been on our inpatient units, and then we've given a special look at our building that houses our developmental disability division because they also have a high rate of elopement, as well as psychiatry has had very, very significant work on their elopement issues with kids who are inpatient for psychiatric treatment. So, but in addition to that, we advanced that to all the other areas of the hospital where they were less likely to occur, but still we were having some occasional concerns. And trainings were provided both inpatient and outpatient, and specifically targeting every inpatient unit. And then we do have random drills that occur in our base hospital where an elopement is actually staged by actors, children and others who agree to actually just reenact one, and we allow our system to kind of work and practice and improve each time. So we've done a very broad range. But you can see how that follows a plan that is very similar to what we try to have parents work through on an individual basis. The other thing we encourage parents to do is to seek professional help, and we have to get asked where. And so when we're talking in a national webinar, it's going to depend on your state, but really your state psychology boards should be able to help locate psychologists, and insurance companies should be able to help you locate psychologists. And then you have to ask a lot of questions about their ability to train on the specific behaviors. If you go to bacb.com, you can find a behavior analyst in your area that may be able to help you or lead you to the proper supports that needed for behavioral treatment of elopement. We partner a lot with the IEP teams of the kids that we serve to continue to work on that appropriate replacement and safety behavior and get those goals often in the IEP. Most of our parents who have trouble with elopement at home, the children often have trouble, similar issues at school, so it makes a lot of sense usually to be practicing the similar things in both locations. And then many of our local developmental disability boards across the country have additional available resources that can help family locate appropriate treatment. So we encourage families to speak up, to ask for help, and to keep plugging away at finding that help that they need for the specific treatment. So if you guys want to ask some questions,